begin momentarily. We will take questions submitted by members of the media after he makes brief remarks. I'll now turn it over to Dr. Alex Garza.
Okay, good afternoon, and thank you all for joining us. If you're a parent or a grandparent, we have some really important information for you during this briefing. And we'll also provide an update on our numbers and talk a bit about vaccinations as well. But first, we're joined by a very important guest. Dr. Richter is a pediatric psychologist at the St. Louis Children's Hospital, and he's here to talk about one of the most important health challenges of the pandemic, the mental health of our children and the feelings of isolation that is so much a part of this situation. So Dr. Richter, thank you so much for joining us today, and I'm going to go ahead and turn it over to you.
Thank you. Yes, I'm Dr. Brian with St. Louis Children's Hospital, and I'm just really glad for the invitation to talk today. I think I'm just going to start off with my ending point, which is that if you are a parent or a grandparent, or if you are, if you're an individual, if you're an adult, and you are worried about your mental health, if you are feeling more isolated, if you're feeling more depressed, if you're feeling more stressed and anxious, I really want to encourage you to reach out for help and be persistent in trying to get help. Talk to your primary care physician, and I'm going to kind of get to some more options in terms of reaching out for help now. But you know what? No one feels happy all the time during or outside of a pandemic. And no one's perfect. And if you are struggling with depression or anxiety, you are not alone. I think a lot of people have the intuition that our mental health isn't as good during this pandemic as it was before the pandemic. And if that's kind of what your intuition is, you're absolutely correct. Now, we still won't know the total effects of COVID-19 on our mental and behavioral health until we're kind of a little bit past it. But some initial preliminary data really does suggest that this is the case. So American Psychological Association Stress in America survey in 2020 really showed us that we're in a national mental health crisis. And just as with COVID-19, St. Louis is not immune to that. Not to throw too much data at you guys, but 8 in 10 people say that COVID is a source of significant stress. 1 in 5 adults have said that their mental health is worse this year than it was last year. And, at Children's, working with kids, teens, parents, families, we've really seen this affect, pretty much everybody in different ways. It's affected younger kids, it's affected teenagers, parents have been super affected and their stress levels are off the charts. Our kids with medical conditions are really struggling right now because all the groups, they might tend to be the ones who are going to be taking more precautions. And that's had a huge effect on people. Not being able to go to school, not being able to see friends. Kids who have behavioral problems. Consequences on physical health, those would be things for sure to get in to see a provider right away. Now, I also always make sure to tell parents, don't be afraid to ask. If you're worried that your kid is thinking about suicide, ask them. That's so important. The other thing that we look for when we're looking to get in touch with a provider is this getting in the way of my child's life at all? Is this causing problems at home? I feel like I can't really connect with them like I used to. Is this getting in the way of things at school? They're not finishing their work. They're not attending class. Is this getting in the way of kind of connecting socially otherwise. Now, in terms of things you can do if you are worried about your child or yourself, primary care physician, pediatricians, physicians, other primary healthcare providers are great resources and a good first kind of stopping place. At Children's, we have a direct line that you can call for resources in our area. It's 314-4514, TEEN. If you're in a crisis, take that seriously. 911, your local emergency room. Behavioral health response is also available in crisis situations, bhrstl.org, or their phone number 314-469-6644. And of course, the National Suicide Prevention Lifeline, 800-273-8255 is also a great resource. But again, no one feels happy all the time. No one is perfect. And if you do think that you're really having a tough time with some of these things, you're absolutely not alone. And I encourage you to take charge of your behavioral health and start making some changes. And I think with that, I'll turn it back over to you.
Great. Thank you, Dr. Richter, for all of the hard work that you're doing with the kids and with the parents. We're all very grateful for all the work that you've done throughout the pandemic. So let's go ahead and move on now to some discussion about vaccinations. Not a whole lot more to update you from our discussion last Friday. However, we did want to reiterate what the challenge is for vaccinations across our region. So as you can see, we did update this slide, though, to better reflect the amount of vaccine that the state of Missouri is getting. So the state of Missouri, according to the CDC, is receiving around 93,125 doses. And so that's both the Pfizer doses and the Moderna doses. If we look at our region, Region C, the high throughput healthcare centers are receiving around 15,600 doses per week that we allocate to the 4 different healthcare systems. And you can see the breakdown of where the vaccine is going by what are called the channels. And so the majority of it does go to the healthcare systems. But as you can see, with that 15,600 and a population of over 700,000 who are currently eligible to be vaccinated, and remember that's the greater than 65 years old or 18 to 64-year-olds with a health condition, you can see how much time it's going to take to get through that population until we can get to other groups to get vaccinated. So the reason why I tell you all this is I think we all realize that we need really dramatically more vaccine if we want to be able to get through this population faster. And there's a lot of things that are sort of difficult to be in control of, and one of them is vaccine manufacturing. So we can only move as fast as the amount of vaccine that we've been allocated. So I just want people to understand the challenges that we're facing. But the one thing that we do know is that even if we don't have vaccine, there are other ways that we can prevent getting sick and getting admitted to the hospital. And it's all those things that we've always talked about with wearing masks, socially distanced, and not gathering in groups. But just keep in mind that the vaccine distribution is still relatively small, and we have quite a ways to go to get through this population. With that being said, if you haven't already, and if you're in one of those eligible groups, you can register for the vaccine with your health system or with the local public health department. So when there's vaccine available for your group, these vaccinators will contact you and get you scheduled for the next available vaccination appointment. Now, currently, the St. Louis healthcare systems are scheduling vaccination appointments for those over 75 years of age and older, and patients with active cancer or organ transplants, solid organ transplants. So please be patient. We're going to continue to share updates as we move through this, and we will get through this as quickly as we can. Now moving on now to our hospital admissions. Let's take a look at our regular hospital data. Our hospital admissions, our daily admission number today that we're reporting, remember is 48 hours, is 41, which is moving in the right direction. So we're getting close to that red line mark of 40, so we're almost below that. The 7-day moving average is now at 54. So again, still seeing those declines in hospital admissions, which is good news. Moving on to our census data now. Today we're reporting 419 patients hospitalized with confirmed COVID. And our moving average now is at 431. So again, it popped up a little bit from over the weekend, but still moving in the right direction. A little bit more detail from our hospitals on census numbers. As I reported, we have 419 patients admitted to our hospitals today with COVID. We have 87 patients in our intensive care units, and we have 65 confirmed COVID patients on ventilators today. Moving on to our suspected COVID patients. Again, these are patients where we're waiting to get a test result back. Today we're reporting 34 patients hospitalized with suspected COVID. We have 8 suspected COVID patients in our intensive care units, and we have 3 suspected COVID patients on ventilators today. So again, numbers coming down very nicely. Our good news slide, today we're reporting, yesterday we discharged 41 patients from our task force hospitals, and that brings our cumulative total to 18,350 patients discharged since the beginning of the pandemic. And again, a big thank you to all of our healthcare teams and the support systems to get these patients better and able to go home to their families and friends. Unfortunately, we're still seeing some deaths from COVID. Remember, these are inpatient deaths. So today we're reporting 6 patients that died yesterday in our task force hospitals. And our 7-day moving average is at 7 right now. But again, that is coming down as well. And again, just to remind everybody that the way to prevent deaths is to prevent people from getting sick enough to come into the hospital. And the way to do that is to prevent cases. And the way to prevent cases is through prevention. Again, wearing masks, socially distant, not gathering in groups. It is a Monday, so we'll share our data from our updated models and again, these are run every Thursday. So this is our, again, updated model from February 4th, which was last Thursday. And you can tell that the curve has become much more sharp, pointing down, which is a good thing. That means we're declining at a faster rate than we thought we would be 2 weeks ago. So again, the model's been updated to reflect what we're seeing on the ground, and that is good news, that we're doing a good job of suppressing the virus and getting those cases down. Just really briefly showing the epi curves from the counties around the St. Louis metropolitan area. All of them are showing similar trends with decreasing cases across the bi-state area. There's really no county that hasn't been following this trend, and so this is all good news. The cases are going down, admissions are going down, and then all of those other metrics will follow. And this is similar to what we're seeing across the state as well in the other major metropolitan areas. Cases continue to trend down across the state of Missouri, which is really good news. Now, you may have heard over the weekend about that variant, the UK variant showing up in the state of Missouri. You've heard us say here before that it most likely was in our population even before it was found. Again, we don't do a lot of genomic testing for the virus, so having found it, it was just a matter of time before we were going to find it. It really doesn't change much. We still need to be doing all of those mitigation strategies, but just to refresh everybody's memory that the UK variant has been found in the state of Missouri. Looking at our reproductive number, it is below 1, and we'll update that here in just a minute when we go over our scorecard. So our bed occupancy, really good news to report with this. This has been the first time in a long time that we've been below that yellow mark for our total inpatient census, the percentage for total inpatient census for COVID and PUI is below that 10% mark. So we're down at 9.4, and that's a welcome sign. And the ICU percentage is also trending down. So you can see we're right around 14%. So have a little bit of ways to go with that, but it is going in the right direction. I've already mentioned our new admissions continuing to decline, and you've seen that sharp decline there over the past week and a half. And so the rolling average now is around 54. So again, still, that's good news as well. Our prevalence is declining as well. So we're down to 4.2. I believe on Friday or last week we were around 5, 6. So that continues to decline as well and has a rather sharp decline also. So that's coming down nicely. And then our weekly change, again, this is looking at the most recent 14 days, comparing it to the previous 14 days. And if it's a negative number, that means the number of cases is declining over time. And so we're showing this negative 20%. Again, that's below our yellow mark, well below that. And so that's good news. And so it's a little bit of a predictive marker for what we're going to be seeing going into the future. And our positivity rate continues to decline as well. And so much further down than those 20% marks that we saw a couple of months ago. So now down to around 11, which is really good news. And the reproductive number that I was mentioning before, today we're right around 0.81. We're calculating it at around 0.81. So again, this means that we're interrupting transmission of the virus, so that's very good news. I'm going to round out our discussion today, again, showing the web addresses for where you can pre-register for the vaccine for each of the healthcare systems. Now, if somebody that you know or somebody that you live with or a friend of yours doesn't have access to the internet or maybe is challenged with being able to navigate through the internet, things like that, please help them to get registered as well, especially if it's somebody that is in one of those high-risk categories. Now, once you've been pre-registered, you're captured in the system, and so then we know who you are. But just be patient and wait until you become eligible on the call list to get scheduled for that vaccine. So we haven't forgotten about you. We just have to make sure we're vaccinating those that are highest at risk first. But while you wait, you can continue to take those steps to decrease the risk to yourself and others by wearing masks, staying socially distant, and not gathering in crowds. Okay, so that is going to finish up my comments for today, and we'll take some questions from the media.
The state announced today they are launching the Missouri Vaccine Navigator. Is this registry separate from the various county and hospital system registries, or will these be combined with the state registry?
Yeah, I've heard about the state registry once before, but I am not familiar with it. The scheduling apparatus that takes place within the healthcare systems, and I believe within county health, although I'm not positive about the counties and the city, are fairly much run internal to those healthcare systems. And so it may register you to go to a certain site, but I'm not sure how the linkages are made, to be honest. But we'll take a look at that. I did see that press release come out, and so we'll have to get some more definitive information just to share with everybody to make sure they're able to find where they need to pre-register.
You talked about the UK variant earlier. How does this news potentially affect the next few months of COVID-19 here in St. Louis?
Well, the only way that it really affects us is that we have to be even more cognizant than we are now about protecting ourselves from the coronavirus. And so by that I mean the UK variant and the South African variant are more transmissible, meaning it's able to circulate amongst the community at a much faster rate than the variant that we're used to. And so it gives you little room for error to slip up by not wearing a mask or gathering in a group or things like that. And so really it doesn't change much as far as recommendations go. It just means that we all have to be even that much more aware that a virus is out there in the community and could cause, a turnaround in the cases. So it could produce more cases going into the future if we're not really careful about making sure we're doing all of those things to protect us from transmitting the virus.
That concludes our list of questions submitted prior to today's briefing. Thanks for watching.